Morning, everyone.
Good morning.
Just lining up everything here to stream. I think we don't have Facebook. Hold on.
Welcome to Tea Time Tuesdays for the attendees jumping on the on-Zoom events. Hopefully you got your tea. And one thing that we wanted to do to kick off Tea Time Tuesdays, in addition to just introduce the panelists on the screen, of course, everybody's here for Dr. Allison Mulcahy. We all love Al, and she's our double board certified emergency medicine and integrative medical doctor. And you probably saw her on Emily Fletcher's wonderful podcast. And we're just thrilled that everybody decided to show up and ask questions and join our community. And so get that tea, get your question ready. And one thing that we wanted to do is take an opportunity to talk about the medicinal value of tea, because it's not something that's a lot of people think about in a medicinal way. And you probably heard of Chinese herbal formulas is herbal teas, and you can drink them 3 times a day and make them medicinal. Like that green tea is great as a diuretic and to help stimulate your brain with L-theanine. But this is also one of the cool teas that I love, and it's called oolong tea. And it's from Tenren. Hopefully you can see that well. Ginseng and oolong together. So everybody's got a Chinatown in their city. So if you go to Tenren and you checked out and get there.
We're just doing a little intro here because I'm on the Instagram is going. So maybe we should jump in.
All right.
I think they can't hear you talking about that.
All right.
So
share the love.
Awesome. Welcome, everyone. So this is just kind of a chill opportunity to get your questions answered. These are a couple of our amazing practitioners for those of you who are on Zoom, Jen and Nikki. And we got all sorts of amazing questions in advance. So what I'm going to do is just kind of go through them. And we're just going to talk about some approaches here based on the questions. And then if you have any questions, if you're live, you can go ahead and write them in the Q&A and we'll get to as many as we can. Any ones that we don't get to, we'll put it on the list for next month. So the first one that I have coming in is from Mary. And she says, I hear a lot about inflammation and that gut imbalances can cause it in the rest of the body. Can you explain more how this happens and some easy little ways that we can reduce or prevent it? It seems so many types of foods and societal habits like long work hours, financial stress, etc., makes this worse, and it feels overwhelming to make big changes to how and what I eat. Amazing question, Mary. So there's a lot in this. We talk a lot about the gut being so foundational for overall health. 95% of the immune system is in the gut. And so if your gut is out of balance, your immune system is out of balance. And your immune system is what causes inflammation. So inflammation is not a bad thing. If you injure yourself, if you get an infection, you want all of your immune system to fight whatever's happening, to basically send out all the amazing cells to help your body to heal. But what ends up happening sometimes is that our immune system gets acutely activated with an injury or an infection, and then it kind of stays activated. It doesn't go back down. And that's when we end up with chronic inflammation. And oftentimes the root cause of this is imbalances in the gut. And so this question talks about long work hours, stress, other things that are contributing to the gut being out of balance or contributing to inflammation. And when we have high levels of cortisol, when we're under stress, our body is in flight fight. So if you imagine wherever you are right now, imagine if a tiger ran into your room, you would want to be able to punch that tiger in the nose and run out of there and survive. And when you're doing that, all sorts of physiologic things happen in your body. So your vessels are going to clamp down, your heart rate's going to go up, your blood pressure is going to go up so that you can survive the next 5 minutes and avoid an attack from that tiger. If the tiger attacks you and does bite you, your blood vessels are clamped down so you're not going to actually bleed. These are amazing things. But you better believe that when your body's doing that, it is not trying to heal things. It's not trying to make sure that you're having optimal hormones. It's not trying to reproduce. Your libido is going to go down, et cetera, et cetera. So over long periods of time, what happens is our gut just doesn't get the love that it needs because our body is constantly trying to survive for the next 5 minutes. So, in terms of what are some little things that you can do? I like things that you don't need anything. You just need your body in order for these things to work. So So little simple things like having your exhale be twice as long as your inhale. That's a huge thing. Another thing that's super helpful is just gratitude practice. So anytime, like, we are all alive, anyone who's watching this, anyone in the world is alive because our ancestors are really good at outrunning saber-toothed tigers. And so anytime that you can think about something positive instead of the danger, that's actually kind of moving the needle a little bit. We're really, really good. I mean, I think everyone can agree we're really good at thinking about all the things that could go wrong, all the dangers. We're not so good at looking at the miracles all the time. And so if we look at everything through the lens of like, hey, like, this life is such a miracle, there's so many things to be grateful for, that shifts us more into parasympathetic. When we're in parasympathetic, our blood pressure goes down, we get more blood to the gut, and overall, we're going to just be more healthy, and that's going to decrease our inflammation. In terms of types of foods, we could spend hours talking about this, and there's tons of debate, but I think like we can distill it down to all plants have amazing little, I think of them as super chemicals called phytonutrients that cause all the different colors of the plants. And so ideally, we're eating all sorts of different types of colors of fruits and vegetables, and that's going to give us all these superpowers, these phytonutrients. And ideally, our plate is mostly vegetables. I think animal protein is good for a lot of people, but what we don't want is sort of the standard American where half of the plate is a big steak, and then a quarter is a potato, and then maybe we have a couple pieces of broccoli, or maybe not even the broccoli. So lots of fruits and vegetables of different colors. In terms of like, if you are acutely inflamed, like if you know that your gut is out of balance and it's super inflamed and you want to look into it, but you want to do something right now, glutamine is an amino acid that really starts to help to heal gut permeability. So I think that combination of all those things can really help to get your inflammation in balance. And you've probably all heard me say, inflammaging is basically anything that causes inflammation is going to increase aging and all the diseases of aging. So anything that we can do to decrease our inflammation is also going to decrease our aging and all the diseases of aging. So if you don't take anything else away from this other than that, if 80% of the time you're making the choice to do something that's anti-inflammatory, you're going to be in a good place. If you go for 100%, that's probably too much. So whenever we try and go for 100% for the A+, the stress of trying to get that A+, the stress actually releases stress hormones and puts us back into sympathetic. So I love the 80% rule for most things. Awesome question. We have another question coming in from Todd. And he says, do stellate ganglion blocks affect inflammation? And if so, how? Can they help my gut and joints feel better? So first of all, for some of you who might not know what a stellate ganglion block is, it's an injection in the neck with a long-acting anesthetic that I think of as basically a reboot of the autonomic nervous system. So if you imagine, if you have your computer open right now or your phone, you have too many apps open and you get that spinning wheel of death and everything just kind of freezes. Generally speaking, at that point, the move is to reboot your computer. When you reboot the computer, it closes all the apps that are not necessary. And then when it starts up again, you just have the necessary apps open and things move better and work better. Now, if after doing that, you open up a bunch of apps again, it's going to freeze again. So what we're doing with the stellate is effectively doing that with our nervous system. So I think we can all agree, especially downstream of the pandemic, that most of us are tipped towards sympathetic. We're tipped towards flight, fight, fawn, freeze. We're kind of in this survival mode all the time, a little bit in our nervous system. And that does not allow us to heal. Again, like if your body is just trying to survive the next 5 minutes, it is not trying to heal something long-term. It's like, I just need to survive 5 minutes. And so in terms of like questions of, helping the gut and helping the joint, I think the biggest thing is like, let's get us into parasympathetic, and then it allows us to heal better. And so short answer is yes, stellate ganglion blocks do help this because it's moving us more into parasympathetic. Now, one thing to mention about these blocks, there are some people that have a really profound effect. Like right after they get the block, it's like their life is different. They didn't realize, how much they've been ramped up, and it feels like they've gotten this new lease on life. And we love it when that happens. And that's about a third of the people that we do these procedures on. 2/3 of the people of our patients, it's not as profound. So another third, you'll notice over time. So it might be that you're driving in traffic the next week, and normally you would have gotten really worked up and upset. And this time you're fine. You don't get upset. You're like, oh, that person cut me off, but no big deal. And then another third of the people, they don't notice anything at all, but it's their friends and family members that notice things. So we get people that come into us because, their partners, their kids, their family members are like, hey, it's time to get another one of these procedures to help balance the nervous system. So I just want to be clear that the effects vary in terms of the subjective improvements from the stellate ganglion block. Some people, it's like it knocks it out of the park, and other people, it's more subtle. In terms of joints, let's talk about that specifically, because I think lots of people have injuries. I live in the Tetons where, everyone's out skiing, mountain biking, hitting it really hard in the mountains, and people injure themselves. So if someone comes in with an injured shoulder, for example, and I just treat the shoulder, but their nervous system's really ramped up, it's not going to heal as well. So the one thing that's important to really take home here is that no practitioner anywhere is ever doing the healing. It's always your body. So all we're doing is trying to help your body to be in an optimal state, really, to heal. And so when we get your nervous system balanced, it's going to allow your body to have the bandwidth, if you will, to heal. And so that's why stellates kind of help with anything, because it kind of gives your body more bandwidth. Great question. Okay, moving on. Next question is from Millie. Can you explain how stellate ganglion blocks support PTSD? And is there any downtime after the procedures? So I think there's a lot of interest about stellate ganglion blocks because it's a pretty simple procedure and can pack a big punch. So it doesn't take very long. It does involve a needle in the neck, which I know is intimidating. And I've had many of these myself, and still anytime that I get one, I am a little nervous about getting a needle in my neck. And I always tell people, if you're not nervous about getting a needle in your neck, you probably don't need a stellate ganglion block. So that's just something to be aware of. It's completely normal to be nervous about this. The gauge of the needle is actually quite thin, so it's not much bigger than an acupuncture needle. It is a little bit longer in order to get it to the optimal spot to block those nerves. So how does it help with PTSD? So PTSD is a imbalance that happens with our nervous system, and it's quite complex. And we could also spend hours probably talking about any of these questions, I bet. But so far, these two questions, we could dig in even more. And for the purpose of today, I'm going to keep things a little bit more superficial surface. And then if you have more questions, I'm happy to dig into that deeper. So when we get into these sort of loops of past traumas, and PTSD, we know that our body holds on to trauma for up to 12 generations. So you could be having a stress response in this lifetime from something that happened to your great grandfather or grandmother. And of course, you're not going to cognitively remember that, but that's stuck in your nervous system. Another interesting thing is these things get stuck in our tissues as well. So, for example, if like your great grandmother, before she ended up having her child, who was your direct offspring, if she injured herself, let's say she had like an abdominal injury and a bunch of scar tissue there, like that is going to actually get passed on to you epigenetically. And you might end up having some chronic pain in your gut, and you're like, I don't know where this is from. And it might be from an injury generations ago that have gotten passed on in the tissue. And so stellates are one way to release the trauma, but really anytime we put a needle into the areas where there's trauma and we release the nerves, we see a lot of release. And so, for example, someone might come in with chronic knee pain, and they've had the knee pain for a long time. Maybe they had a small injury in high school or something, and it's been bothering them. And we can do nerve releases, and people can have really big emotional responses. Many, many times I've had people on the table after I'm injecting them, and they just start crying and they don't know why. They're like, it didn't hurt that much. I don't know why I'm crying. And it's because that trauma is stuck in our tissue. And this is a real opportunity to release it. So, in terms of PTSD, it's complex. Like, most people, we need in order for someone to get PTSD, there's a whole set of, it's kind of like the Swiss cheese model. Like, a lot of things have to line up for that to happen. If Jen and Nikki and I all, went to a concert together, say, and there was a mass shooting and we were all there, it might be that I developed severe PTSD from it, and Nikki doesn't have any side effects, and Jen develops mild PTSD. And that's all about like how much bandwidth does our nervous system have to begin with? And what has happened to us previously, and what are our constructs, and energetics come into this as well. So it's pretty complex. And what stellates can do is help to balance that nervous system to give us more bandwidth. And what we see with, I've done stellates on many, many veterans and people that have like sort of textbook legit PTSD. And it just like, it's kind of like it allows them to release that trauma from their body. And a lot of times they don't even realize how much they're holding on to it. And it's kind of like they're just stuck in this flight fight from something that happened, and it just allows the nervous system to relax. In terms of downtime after the procedures, so we're all producing our endogenous stimulants, right? So if Jen and Nikki and I, like if I am, let's say that I'm a cocaine user, and let's say that Nikki is a meth user, and let's say that Jen drinks a ton of coffee. And if we all stop cold turkey, like Jen might have some headaches, she might not feel good for a day, but it's probably not going to be like, it's not going to be super dramatic, her withdrawals. But for cocaine and meth, if we stop, and we've been using a lot, we're going to have pretty significant withdrawals. And it might be a rough ride for a couple of weeks. And I think we can all agree, though, that it would be certainly better for me to not use cocaine, or for Nikki to not use meth. And so it's kind of the same idea with our nervous systems. So if I'm producing a ton of stress hormones on my own, and then I get a stellate and it removes my own supply of those hormones, like those stimulants, I might have a rough ride. So in terms of the downtime, like it might be like I'm withdrawing from cocaine. And we do see some people that feel profoundly tired after. People can feel emotional. Another way that I like to think of it is, if you go outside and your hands get super cold in the winter, like I live in an area where it gets quite cold in the winter, and occasionally my hands will get actually numb. And what we affectionately call it when the hands warm up is the freezy barfies. So if your hands are frozen and you can't feel them, it doesn't hurt, but that's not a good thing. And then when they warm up, it's super painful initially. And you still know that it's a good thing, like that you want those nerves to wake up. So it's the same thing with that we see happens with the stellate. So when we block it, for a period of time, about up to 6 hours, the actual stellate ganglion, which is the sympathetic chain, will be blocked. And then as it wears off and as things equilibrate over the next week to 2 weeks, sometimes even longer than that, people can have all sorts of ranges of emotions, feelings, sensations, et cetera. And I think of it as like the nervous system is equilibrating. And we have seen so many things under the sun. We've had people that have had fusions of their cervical spine, and then we do a stellate. And because of all the scar tissue from that, a lot is locked up in there. And they will have I've had people have migrating pain throughout their entire body for a day or two, and then it equilibrates and their pain is way better. So the downtime is going to depend from person to person. I always recommend that people make sure that they really take care of themselves in the time around and during and after these procedures. And some people might not really notice much. Like I definitely get people that say I didn't really notice much. I think I almost everyone, if not everyone that we have ever done a stellate on, like if we check them longitudinally, meaning if we check in with people that they know, if we check in with data, if we check in with them, weeks to months later, it has moved the needle. But again, it might not be that super life-changing, on the table where people have this feeling like I've never felt this way before. And And so I always recommend that people anticipate that for a couple of weeks, it might be a little rocky. And if it's not, that's fine. And also the rockier it is, in my experience, the better the long-term outcomes are. So if people, again, back to like the cocaine, meth, coffee, like Jen is drinking coffee, she doesn't really have that much of an effect when she stops it. I am using cocaine. When I stop it, it's a rough ride, but the long-term benefits of stopping cocaine for me are going to be more. So that's just something to consider. We practice personalized medicine or precision medicine, which means that like each person is different. So, you know, we can anticipate a little bit of like who's going to have a more profound effect, who's going to have kind of a rougher ride after. And I've been surprised with people that I think like, oh, this is going to be easy for them, it's not going to be a rough ride, and it is, and vice versa. And so I think like each individual is going to have their own amazing journey with this. And I would be remiss to say like, hey, everyone should make sure that they take a week off or 2 weeks, and it's just different for everyone. Awesome. I'm going to move on to the next question. It's coming in from Olga, and she says that she's been dealing with constipation and hemorrhoids, and she was recommended to take psyllium or stool softeners and receive Botox for anal fissures. No one has looked at her diet. She stated that her constipation is more remarkable in the second phase of her menstrual cycle and worse when she is stressed. Reflecting on the eating for the gut handout, meat, dairy, and gluten were not mentioned. She's curious if these are okay to eat or do they cause constipation? Okay, so these are all, there's so much here as well. And with each of these questions, like really, we could spend an hour talking about each of these questions. So I'm again going to do kind of like 35,000 foot view here. What I see from this is that there's some imbalances in the gut. And probably most of you know at this point that we are made up more of microbiome of bugs than we are cells, which is like it's still mind-blowing to me to think about this. And so what I would say is Olga, in all likelihood, does not have a microbiome that is working optimally for her. And so we could do things like, Botox for anal fissures. Sure, that's going to help to release the muscles around her anus to minimize the fissures, but it's not really getting to the root cause. In diet, I love optimizing diet for sure. And in big picture, we talked about phytonutrients. The other thing that I think is super important with diet is looking at anti-inflammatory foods. And again, I think when we get really, really stressed about what to eat and what not to eat, that stress is harmful. So just look at it through the lens of what is causing inflammation and what is not. So I always talk about, and I've talked about this for years, even when I was working in the ER, I would talk about the 3 whites that cause inflammation. So gluten, sugar, and dairy. And we get lots of people that come in talking about things like, should I cut out nightshades? Or, I think I'm eating too many lectins, but they're still eating sugar, they're still eating gluten. So I'm always looking at what's going to pack the most punch. So for most people, particularly people of European descent, white people, gluten, almost everyone that I check has some sort of sensitivity to gluten. So what is that doing? That's causing inflammation in the gut for most people. And oftentimes it's also causing reactivity in the thyroid because of the connection between gluten and thyroid. The proteins look almost identical. So if someone is eating gluten and they're reacting to it, there's a good chance that their immune system is also attacking their thyroid. So cutting things out like gluten and dairy and sugar can certainly help. And I would want to know what else is happening here. So it's been kind of astounding to me. Again, I live in the mountains. I treat lots of people that do a ton of camping, lots of guides, and it is shocking to me how many people I've found that have chronic giardia, for example. So if Olga, for example, I don't know where she's from, but if she's running around and has giardia, and we're trying to adjust her diet to heal this, it's kind of like moving deck furniture around as the Titanic is sinking. So what we want to do is figure out what is causing the Titanic to sink, so to speak. And oftentimes it's people have these chronic parasites that they don't even know about. I would say probably like broad strokes, a third of our patients come in with some sort of parasite that they didn't even know that they had. And then once we get that imbalance, it makes it much easier to get the rest of the microbiome in balance. When we talk about constipation versus diarrhea, again, we could go down a real rabbit hole here. I like to keep things simple. So what this tells me is that her gut is not in balance. So in an ideal world, like our colon reabsorbs water so that our stool is the perfect consistency. If we're reabsorbing too much, it gets really hard and constipation. And if it doesn't absorb enough, then it's really leaky. It's really loose, like diarrhea. Other things to consider is gut motility. So we have our nervous system in our gut is actually bigger than our central nervous system. And so if our gut nervous system is not working optimally, and our peristalsis, which is basically like the squeezing of the intestine to move the stool through, if that's not working, then that can cause constipation as well. And interestingly enough, the stellate ganglion block, which we also block the vagus nerve, that can help because the vagus nerve is the longest nerve in the body. It connects the central nervous system with the enteric nervous system. And by rebooting that, and also we do releases of the nerve kind of up high, like around the first cervical vertebrae and in the neck. If that nerve, like if you imagine if this is a nerve here, and the nerve is stuck in the tissue. So we have fascia, and fascia basically is like, I think of it as like saran wrap around muscles. So the fascia should like just flow easily, and the nerve should flow easily in between. Nerves, veins, arteries all live in the fascia. If we have an injury, inflammation, infection, what can happen is it grabs on that nerve. And so instead of like flowing easily, it's grabbing, and then it doesn't work as well. So, this is a wire that's going to my headphones right now. And if I were to crimp it, the audio going to this wouldn't work very well, and you wouldn't be able to hear me as well. The same thing happens with our nerves. So if the vagus nerve is getting grabbed around C1, for example, it's not going to send the signals as well down to the rest of our body. And that can actually impact your body's ability to digest. So sometimes actually a lot of times, just addressing the nerves, releasing the nerves can make a huge difference in what's happening systemically. For Olga, I would say similar to the last person, like starting with helping to like heal the gut lining is important. So things like I like using immune globulins and glutamine supplements to just kind of help support the healing of the gut. And then I'm very data driven. So my background is, I have a degree in chemical engineering. I studied conventional medicine. I've done many fellowships. I'm double board certified. I like data. I don't like to just be like, willy-nilly trying things. And so I would like to see like what is happening in Olga's microbiome. And again, let's say Olga, Jen, Nikki, and I all have the same symptoms, the approach is going to be different depending on what we find in our microbiomes. So it might be that like I don't have enough digestive enzymes, for example, and that my nervous system is really out of balance from a head injury, and that's causing it. It might be that Jen picked up a parasite somewhere. So we really want to see like with each individual person, what's happening. In broad strokes, like cut out those 3 white things, gluten, sugar, and dairy. Like I think we can say with pretty good certainty that that's not going to hurt anyone, and it's probably going to help most people. One comment on that actually is similar to the withdrawals that we get from stellates. When you cut those out, your microbiome is going to be really upset. So your microbiome, if you eat a lot of sugar, for example, those bugs that love the sugar, they're kind of controlling you. And so it's going to take about 6 weeks for them to like die off enough that they're not causing you to have tons of cravings. And on that note, the opposite is true. So I love recommending that people eat smash fish, which is salmon, mackerel, anchovies, sardines, and herring. They're cold water, fatty fish that give you lots of omegas. Things like sauerkraut, also really helpful for helping the microbiome. lots of people, and I'll put myself squarely in that category, do not naturally love the flavor of those things. And so but you can fake it until you make it. So if you're like, okay, I know that sauerkraut would be good for me to eat, just start eating it and like plug your nose or do whatever you need to do to eat it. And then after about 6 weeks, you're actually going to like it, and you're going to kind of crave it and desire to have it. And the opposite is true as well. So if you're like, hey, I really want to cut out gluten, but you're having lots of cravings, just cut it out and know that like 6 weeks later, it's going to become a lot easier. But it is a lift for those 6 weeks. Gluten is interesting because it stays in the system for a long time. So that it gets caught up in this biofilm that bacteria produce. And so it actually will stay in your system for many months, producing inflammation, and can also kind of keep those cravings going. So we've got enzymes that help with that process as well. Okay, another question here coming in from Julie, and she's asking if we offer hydrodissection consultations. I didn't read these before though, but that was like perfect timing that I was just talking about the hydrodissections, which is basically what I was saying, injecting the fluid in and releasing the nerve there. So she said that she received information from a provider in Bend, Oregon, and she's dealing with chronic sciatic pain that she believes resulted from intramuscular injections. And do we offer hydrodissection consultations or know anyone offering it in Oregon? And she said she'd be willing to travel. So this is like, these questions are great because each of these questions are so many things to talk about. One thing I want to mention with this, specifically with sciatic pain, is we get lots of injections in our butts, and also for those of you who get pellets. So pellets are a type of hormone replacement therapy that I think in theory are amazing, because you just put this little pellet into your butt and then it leaches the hormones over a period of weeks, and you don't have to worry about taking hormones every day. The problem is you can get scar tissue buildup. So back to what I was showing, you've got your nerve here, your sciatic nerve, and it's got this nice fascial plane, and then boom, you get some injections around there and suddenly it's grabbing on it. The sciatic nerve is a giant nerve. It's like the thickness of it is as thick as my thumb, and it goes kind of from your spine down through your butt and then down the back of your legs. And probably most people have heard of sciatica and sciatic pain. And so amazing treatment for this is injecting around the nerve, releasing the fascial plane, and then the nerve is way happier. So in terms of consultations, the way we do things is I always look at everything, and Jen and Nikki do as well. We look at it holistically. So if you come in with sciatic pain, we're not going to just inject your sciatic nerve. We're going to look at what led to that. And maybe it's really simple. Maybe it's really just your body is in balance and you got this injection. It happened to be in the place that caused some inflammation and scar tissue. And tons and millions of people get intramuscular injections all the time and don't get sciatica. So we want to look at why did your immune system, what happened with your immune system that caused the inflammation, that caused the scar tissue to make you have these symptoms now? And it's kind of we could totally go in and release that nerve, and it would probably give you a lot of symptom relief. And if we don't address the imbalances that led to that happening, you'll have something else pop up somewhere else. It might not be the sciatic nerve, and you might not even put it together that, hey, the same thing that caused my sciatica is now causing me to have chronic knee pain, for example. So our goal is to help get people in balance so that we just see you at the grocery store. Our goal is not to have to keep doing hydrodissections on you every 6 months. Our goal is your body is brilliant. Your body knows how to heal itself. What can we do to kind of give your body support to heal itself, or take away things that are getting in the way of it healing itself? I don't know anyone in Bend specifically to answer that question. And I'm sure that there are people in Oregon that are doing this. Lots of people are doing, just broadly for regenerative medicine, there are lots of people doing joint injections and soft tissue injections. I would say there are fewer people that are doing the hydrodissections. I think there's probably various reasons for that. when I started learning this, I was very naive, thinking I could go to a weekend course and learn how to do all this. And the more that I know about injections, the more I realize I don't know. Our bodies are beautiful and complex, and there's lots of nerves everywhere. And so to understand like where the nerves are and to safely inject and release them just takes training. So and there's just not as many people that are trained in it to train people. So it's a little harder to find people that are doing the hydrodissections, and they definitely do exist, and it's growing, which is amazing. And another thing to mention is sometimes if we release a nerve, that's all we need to do. So for example, like we could have someone that has degeneration of their knee and they're having chronic pain, and we release the nerves that are going to the knee, and then the knee pain improves. Now, they might still need some help with actually healing the joint, for example, if there's cartilage broken down, and just healing the nerves will help the immune system to be able to heal the knee better. Great question. Another question coming in from Micah: Pitta diet, tired all the time and otherwise jittery. So Micah says, recently I've had to cut out soy, sesame, wheat, almonds, hazelnuts, walnuts, and peanuts due to newly discovered food allergies. In Ayurvedic terms, I'm Pitta. What diet/lifestyle would best support my body? How can I nourish my body? I feel tired all the time, otherwise jittery and jerky. It's like I can't rest. So for those of you who don't know about Ayurvedic medicine, this is a great, these are all like, I love all these questions. So Ayurvedic medicine is, in addition to Chinese medicine, are the oldest forms of healing out there. So Ayurvedic medicine has been around for 5,000 plus years. And in Ayurvedic medicine, the idea is that you have, there are 3 doshas that are it's kind of like your primary constitution. And Pitta is one of them. Pitta people get pretty aggravated by heat, spice, fermented foods, things like that. And so in terms of like what, and most people are like, might be like Pitta dominant with some Kapha, or Pitta dominant with some Vata. Those are the 3, Vata, Kapha, and Pitta, or Kapha dominant with some Pitta. Like it's usually not just one. And so again, like back to like the personalized precision medicine, with Micah, I would want to get some more information than this. And with the information that I have, Pitta folks need cool. So particularly in the summer, it's a time when your Pitta can get super aggravated, and that can cause like upset belly, kind of like gas, like acid reflux symptoms, heartburn. And so eating cool raw foods is helpful, making sure that you're cooling your body down. So like if it's a hot day and you're kind of like, oh, I feel miserable, I feel so tired, and I feel nauseated, like go get in a cold shower, go jump in a body of water. It's remarkable how much that will help. Don't eat spicy foods. Spicy foods will make things worse. And in the winter, it's probably not a big deal if you're living in a colder environment, but for sure in the summer, be careful about these things. Fermented foods as well can aggravate Pitta. When I hear someone that has all these food allergies, whenever anyone has a ton of allergies, it's not really that you're allergic to all these different things. It's that your gut is permeable and inflamed. And so when I worked in the ER for years, there would be people that would come in and they were allergic to, basically every antibiotic under the sun. And I didn't have the understanding then that I have now, that just means that the immune system's out of balance. It's not really that like people are allergic to each of these things. And same with food. So oftentimes when their guts are really inflamed, they're reacting to all these different foods. And the move is not to cut everything out. So the move is to like decrease the inflammation and get the microbiome in balance so that you can eat as many things as possible. All the foods out there, all whole foods have amazing nutrients that are important for us to live optimally. And so when people come in that have really restrictive diets, that's pretty harmful. It's hard to get all the nutrients, phytonutrients, vitamins that you need on a restrictive diet. And so, I would say with Micah, I would want to see like what's happening in your microbiome. So again, the way we check it is we have you poop in like a little fry container, and then take little scoops of the poop and You put it in a little test tube and send it to the lab, and then 2 or 3 weeks later, we get the results. So we could give you some supportive stuff. Everything that I've mentioned before, like glutamine and immune globulins are helpful. And I would want to know exactly what's happening with you. And really good. I love that you're aware of the Ayurvedic doshas and recognizing that, like, hey, I'm Pitta, and how is this contributing? So go jump in a body of water after this. Next question is managing sleep schedule for energy. And this one's coming in from Cece. And she says, as a longtime night owl and recovering workaholic who worked crazy hours for decades, what are my best tips for getting consistent, better sleep with an earlier bedtime? I tend to yo-yo in my sleep schedule and energy level. If I go to bed early one day and slept really well, I have so much energy that I screw up the next day and wake up tired again. How do I keep it consistent so I get good quality rest every night and have good energy every day? Awesome question. So many things coming through here as well. The first thing I'm going to say is, again, I love data. So here I have an Oura ring, if you can see this. And it's a biofeedback device that will measure your sleep. So it'll measure your deep sleep, your REM sleep, your light sleep. It also measures things like your heart rate variability, your oxygen saturation, your heart rate. And so by collecting data, you can see what happens when you actually change your schedule. So that's a first thing as you're making your own little experiment. So I love recommending that people try things and see like what works best for your body. The other thing to mention is, you're a night owl and you're living in a society that supports early birds, right? Like everything in our society supports, like, the early bird gets the worm, and like wake up early, and like, school starts early, et cetera, et cetera. And it might just be that your constitution naturally is like more of a night owl. And so like, if you try and force yourself into getting up early, that might not work for your particular constitution. So that's something to consider as well. And sometimes our jobs make it such that like we have to wake up at 5 a.m. every day, even though our natural cycle would be to wake up at 9 or 10. So I think like those, like collecting data and considering that, hey, like maybe it's totally fine for you to just be a night owl. Sleep hygiene, super important. And this might be, for some of you, this might be like old hat, but for those of you who don't know, like we need to be sleeping in cold, dark, quiet environments. And I worked shift work for years. And so I'm very well aware of like when I walk into a room and I'm going to be sleeping in it and there are not darkening curtains, I think like, okay, I'm not going to get as good of a night of sleep. So if you can set up your room so that you have darkening shades and so that your environment is cold at night and quiet, that's going to really support you having optimal sleep. Other things, gadgets. So these gadgets are so activating for us. So shut down the gadgets at least 3 hours, if not more, before going to bed. Also, stop eating any calories at least 3 hours before. At night, put on blue light blocking glasses. And you can put on the orange ones that are going to even calm your brain down more. And you'll notice if you put on orange blue light blocking glasses, like you'll immediately just kind of feel your nervous system relax. Another thing that I always love to mention is your night's sleep, like a good night's sleep begins with what you do first thing in the morning. So really like what you do right before bed is important, but not nearly as important as what you do first thing in the morning. So as soon as you get up, if you can, go outside and get the sun on your retina. And that's going to cause your body to release a cortisol spike, which is a stress hormone. We need cortisol. It's super important for us. And that's going to kind of start your day. And then that will allow your cortisol to kind of go down throughout the day. The other thing that happens throughout the day is your adenosine goes up. Adenosine is another neurotransmitter that is related to our sleep drive. So when you drink caffeine, it's basically blocking your brain's ability to sense the adenosine. And so if you read, there's a book called Why We Sleep by Matthew Walker, which is a great read or listen that I think goes over a lot of this stuff in more detail. But for a lot of people, any caffeine is going to impact their sleep. So that would be another thing to consider, is just like cut out caffeine completely, which there might be an equilibration period of a few days. And then once you've cut it out, you'll probably find that your sleep is deeper. And we could go, we could talk way more about this. Rebooting your nervous system helps with that. Your microbiome as well, like the bugs in your microbiome produce neurotransmitters that make us feel good, things like serotonin, oxytocin, dopamine, but can also produce neurotransmitters that make us feel anxious. So gut health is important for sleep as well. Next question, long-term alcohol addiction. This is from Sharon. Just curious about any work you may be doing to support long-term alcohol addiction. My son has childhood trauma and ancestral addiction on both sides of the family, heavily tied to AA, and has been working with a therapist, but has not ventured into any alternative or holistic practices beyond meditation. He's in his late 30s and will nearly kill himself in a 2-week relapse. Wondering if you can point me to any information to share. Blessings to all of you. This is much needed work. I've been on a path for 6 years after doing work with horses and then returning to be certified in the work. In this moment, I'm in HR hospital setting. I'm in an HR hospital setting, holding space the best I can. May your work continue to grow and bless exponentially. Well, first of all, Sharon, I'm so sorry about your son. That's such a hard place to be in, and lots of thoughts here. This is another question that we could spend hours on. So again, amazing questions. And thank you for all of the work that you're doing. So a couple things that I would mention. One with alcohol is NAD. So, and again, we could talk about NAD for a really long time as well. NAD is, I think of NAD as kind of like the fuel for our mitochondria, and mitochondria are basically the engines in our cells. And so if we don't have enough fuel going into our mitochondria cannot produce ATP, which is what energizes, what drives all of our muscles, all of our metabolic processes. And what we have found, and I'm not sure, I haven't looked into the research on this recently, so I don't know which, chicken and egg, where this lies right now. But what we have found is giving people NAD infusions. They've done studies. The initial research came out of Springfield, Louisiana, giving people high dose NAD infusions. So IV NAD up to like over 1,000 milligrams, which takes many hours. Doing 10 days of that is more effective than a 30-day inpatient program. So that is something to look into and consider. And another thing is most of the time, people are drinking or using substances because of uncomfortable emotions, because of trauma that it's hard to feel. And so things like stellate ganglion blocks, helping to balance the gut, can help us to shift so that we are producing more of the feel-good neurotransmitters. Like I was just mentioning, the serotonin, oxytocin, dopamine, that we don't like, that makes us feel good. So we don't have to reach for a substance to sort of numb out what we're feeling. We live in a time right now where we are exposed to insane amounts of stress every day. Even if our lives are pretty easy and we're not, financially stressed and we're healthy, globally, there's all sorts of things happening right now with the climate, et cetera. So most people are under stress. And then if you've got genes that make you more predisposed to things like alcoholism, there are ways that we can kind of intervene to help make it so that you don't move in that direction. So with genes are only about 10% or so of the story. And what that means is, like, I could have a gene for alcoholism, but if I don't drink, I'm never going to become an alcoholic, for example. I could have a gene for celiac disease. If I don't ever eat gluten, I'm not going to develop celiac disease. And so I think, with your son, he's already developed alcoholism. So what we want to do is look at like, what is driving him to drink, and how can we balance that nervous system so that he feels calm and happy and, blissed without having to reach for something. GABA is like the primary neurotransmitter that is released with alcohol, and GABA is a really chill out neurotransmitter. And so it helps people to relax. But then, as you were saying, like when your son comes off of alcohol, then he gets this like basically spike of feeling worse as the GABA goes down. So things like psychedelics, like ketamine, for example, we use frequently. It increases GABA and decreases glutamate. So it increases the chill out neurotransmitter and decreases the excitatory neurotransmitter and helps people to feel a lot better. So many different ways that we could approach this that would probably be super effective for him. Okay, next question from Amy is she's asking what our fee is for a 1-hour consult. And right now it's $495, and that includes a health coach and an hour of the health coach's time. So the health coach is kind of, if you haven't worked with health coaches before, they're amazing. They take notes during the appointment, and they're kind of your accountability buddy. They help to distill this down into easy bite-sized chunks. Like what we do can be really complex and overwhelming, and they're kind of like your buddy helping you through the whole process. And so you get an hour of their time outside of the appointment where you can work on a specific thing, coaching, or they can help you, to navigate a gut protocol, for example, et cetera, et cetera. Next question is pursuing this track while being interested in other forms of medicine. This is from Victoria, and she said that she is a recent graduate and she's thinking of pursuing medicine. And she was wondering if she could ask me about pursuing this track while also being interested in alternative forms of medicine. So I think what Victoria is asking is kind of like how, if she were to want to work in a way that I do, like how do you get to that place? And the unfortunate thing in 2023 is there's no direct pathway right now. So you could go to conventional allopathic medical school like I did, and then you would have to add on fellowships like functional medicine, integrative medicine, ultrasound to get the training in order to be able to do what I'm doing. You could go to naturopathic medical school. And then if you wanted to do injections and other things, you'd have to do additional training. You could go to chiropractic medical school. And then in order to be able to do everything, you'd have to get additional training. So as of 2023, unfortunately, there's not a direct path to this type of medicine. And that's one of the things that myself and a lot of my colleagues are really passionate about is helping to create educational systems to allow people like you to get to this way of healing and wellness as a practitioner without having to go through all these like circuitous paths, which is what it requires now. And that requires really tremendous amounts of time and resources, which I feel very fortunate that I've had the luxury, I guess, to do all these courses, and a lot of people don't have that. So it'd be really nice to have an educational system where it's like, hey, someone who's just graduating from undergrad and wants to do this, it's much more fast-tracked. Great question. And like Nikki and Jen, like they both have, amazing toolboxes as well in holistic medicine. And like we all have our tools, but like in an ideal world, we're combining them all. So, working integrative medicine is the umbrella under which all healing modalities with evidence lie. And so in an ideal world, we are like, I come in and I feel sick. I have chronic headaches. In an ideal world, whoever is working with me implements like nutrition, like it looks at it through the lens of nutrition, Chinese medicine, like cutting edge therapies, meditation, like all these different things to get my body in balance as soon as possible. And unfortunately, even in the alternative medicine world now, it's pretty siloed. So you can go to a nutritionist and they're working by themselves. You can go to an Ayurvedic practitioner, they're working by themselves. You can go to a chiropractor, they're working by themselves. And they may or may not understand how all these other people can plug in. So one of our aspirational goals is to have democratized integrative wellness centers around the world. And by democratized, I mean having this accessible for everyone. So, right now we're in a time where a lot of these treatments they're not covered by insurance, and they're only accessible to people who can afford them, which I worked in county ERs for years. Like that is not okay to me. And I'm really passionate and committed to developing a way that like anyone and everyone can benefit from this approach of doing things. And I think like ultimately it's way less expensive to keep people healthy than to treat people when they're sick. And so it doesn't make any sense to me to wait until people are really sick to cover it. So I love, Victoria, that you're interested in this. And I think, you know, hopefully in another 20 years, the climate is totally different around all these things. Okay, the last question that came in advance is from Sherry, and she said that she was listening to an interview with me and looking a little bit about my work in functional medicine, and she said, I'm always looking to heal and become more in harmony with my body, and I've definitely been dealing with some things and would love to see me and see if I could support her. So I think like functional medicine, there's a lot of buzz around this right now. And I think this is an opportunity to just like describe a little bit where functional medicine lies. We do a lot of functional medicine. I think naturopathic medicine and functional medicine are quite similar, and they're under this broader umbrella of integrative medicine. So under integrative medicine is like what Jen does, which is she's a functional medicine practitioner, but she also is a Chinese medicine practitioner. What Nikki does, she does a lot of functional nutritional work. What chiropractors do, energy medicine healers, everything is under that umbrella of integrative medicine. Functional medicine is looking at like more specifically, like it looks at root causes, and it looks through the lens of like all of our metabolic systems, our gut, kind of like getting data and addressing all of those imbalances from a root cause perspective. I like to bring in all the things. So like when we do ketamine, for example, like we're doing craniosacral therapy and sound healing at the same time that we're doing ketamine. And then we're also addressing the gut and looking at energy imbalances at the same time. So, and that actually reminds me back to that sciatic nerve question in terms of energy. So one of the things that I do is I'll do little grounding meditations. And I was doing a grounding meditation the other day with some people, and I'll have people put grounding cords on. So just imagine, you could imagine like putting a tree trunk and connecting it from your root chakra down to the center of the earth. And then imagine like grounding out any energy that's not you. So, and then I also will kind of extend that to do grounding cords that will specifically ground out energy out of certain areas. So the sciatic nerve, we hold a lot. It's down near our second chakra and our root chakra, which are our body energetic areas. And we can hold a ton of like thick energy there. And people, when they're stressed, will throw energy at us and it might get stuck there. And so an interesting thing is if we imagine grounding the energy out of our sciatic nerves, and I've done this with people, the pain can improve significantly. So we're also always looking at like energetic causes. So if, and we know, and again, I'm data driven. So we know that metaphysically, like we are creating our own realities. And if we have blockages, if, from belief systems, or we're afraid of what's next, like one example is like, if you're not sure about what's happening in the future, your knees can hurt. If you're afraid to take the next step forward, you can get foot pain. And so I always look at it through that lens as well. And I have resources that I use for that. And since I've started incorporating that into my time with various patients, like almost 100% of the time, when we go over what the metaphysical, what the kind of energetic causes, it resonates with people. So I think, pulling all these different modalities in to help people get in balance most efficiently, it's amazing. And I think that's kind of like where we're going in medicine. All right, well, I could not have timed that better. That was like all the questions, and now we're at our hour. So I'm sure there are additional questions, and what we'll do is we'll have them lined up for our next Tea Time Tuesday, which is next month. And then I don't know, Jen, if you have anything to add just from comments that people were writing in. And otherwise, I so appreciate you all joining us this morning, and we'll be back again in a month. We can't hear you, Jen.
Ah, there you go. I didn't have the power. So thank you for enabling. So yes, everybody was very lively in the conversation, and it was just very much echoing how it resonated with them. And so you definitely spoke to everyone in the Emily podcast and also here, and are psyched for next month. So thank you guys for joining us, and we'll see you the first Tuesday in September.
Woohoo! Have a great rest of your day, everyone.